Hi everyone, thanks for tuning in as always. So this week I'm going to talk about another men's problem because they haven't had that much of a crack at the whip, and this is a serious issue that we're going to talk about. So we're going to discuss prostate problems, and prostate problems are common, especially in men over 50, and there are several conditions which can contribute to problems within the prostate, ranging from simply getting bigger all the way through to cancer. But for the purposes of this vlog, we're going to talk about the increasing size of the prostate gland, so prostate enlargement, and prostatitis, which is an infection in the prostate. We're going to leave cancer for another vlog because it needs a whole vlog of its own, and I will do it in the coming weeks. Okay, so firstly, to start with, what is the prostate gland? Well, it's a small, unique gland to men that's wrapped around the urethra, the base of the bladder, and the vas deferens. The urethra is the tube that brings urine from the bladder to the tip of the penis and out of the body. The vas deferens is a tube that brings fresh sperm that have been made in the testes out of the body, and obviously the bladder holds urine. The prostate in this role produces a fluid which is added into the sperm and produces semen, which is then a man's ejaculate. It's about the size of a walnut, and it tends to get bigger with age, sometimes because of medical conditions and sometimes just naturally with age. So let's start with talking about enlargement. Enlargement is known as BPH, or benign prostatic hypertrophy. BPH here on in. It's common, with at least a third of men over 50 experiencing some symptoms, however slight, from their prostate slowly getting larger. It's a benign condition, as in the B, and as it gets bigger, it applies pressure on the urethra, which is the tube carrying the urine out of the body, and that then causes problems as it gets bigger and more pressure is applied. So the kind of problems that we're talking about are all involved with peeing, and they include difficulty starting to pee, needing to strain to actually get the pee out, a very weak stream that goes on for a long time, sometimes happen to double void, so waiting a minute or so and then going to pee again to make sure that your bladder's empty, dribbling at the end of the stream, frequency of urine, so going all of the time, and especially at night, that's called nocturia, so some men get up 5, 6, 7 or even more times in the night and feeling like you haven't completely emptied your bladder but there's no more stream coming. So all of these symptoms can be quite distressing, obviously. So who gets it? Well, as I've said, it increases with age. In men 31 to 40, it's about 1 in 12 men experiencing these kind of problems. Once we get from 51 to 60, it's 1 in 2, so 50%. And then once we get over 80, it's 80%, so 8 in 10 men have some sort of problems. It's important to know, however, that only half of men who actually have enlargement of their prostate experience any symptoms from it. So how do we diagnose BPH? Well, as a GP, with a man presenting with these problems, we would first of all take a really detailed history, find out how long things have been going on, what exactly was going on, and how it was affecting day-to-day life. We'd ask questions to make sure that we didn't think there was something more sinister going on. We would need to put a finger inside the man's back passage to feel the prostate, to make sure it was nice and smooth, as it should be in BPH, to see what size it was, and to make sure that it isn't tender, because that would indicate something else going on, like inflammation. We would do a blood test called a PSA, which is a protein which is given out specifically by the prostate, and with the rest of the picture can also give us an idea of what's going on and to make sure it isn't sinister. Once we've got all of this information together and we've made the decision that it's BPH, we can then go on and discuss treatment. If we're at all concerned or we're not absolutely sure, we would refer on to a specialist urologist who could then take it further. So in terms of treatment, it really depends on your symptoms and how you feel about treatment and what you want to do about it, because you're the person suffering or not. So it's a discussion about what's available and what would suit your lifestyle best. So if the symptoms were mild, you might decide that you can tolerate them and do nothing. But alongside that, you could make some lifestyle changes to try and help the situation. So we would encourage you to cut down on alcohol and fizzy drinks. cut down on caffeine, add more fibre, fruit and veg to your diet to make sure that you're not constipated, because constipation can actually make the symptoms worse. To reduce your fluid intake in the evening to try and minimise the number of times that you need to get up in the night. To double void, so when you do go to the loo, to just wait there for a minute or so and then try and empty your bladder again. Bladder training can sometimes work, and that's a whole heap of exercises where you hold your pee for longer before you go and things like that. And we would give you a chart to help you and chart symptoms and where you are in the process. Exercise is always good for all of these things. And then we would check your medications to make sure that we weren't giving you something that could be making the symptoms work. So for example, decongestants to unblock noses can actually make things worse, as can antidepressants. So that would be the initial approach that we would take. If, however, your symptoms were moderate to severe, so really interfering with life, that you warranted or wanted a medication to try and help, or another treatment, we have that available too. And these treatments are aimed at taking the pressure off of the urethra so that you don't get the symptoms quite so much, and reducing the size of the prostate, so that in itself takes the pressure off and reduces the symptoms. So starting with medication, the initial medications that we can use are alpha blockers, which concentrate on relaxing the muscle of the prostate gland itself and the bladder to ease symptoms. And you'll know these tablets of tamsulosin and alfuzosin. Then we have anticholinergics, and these are again bladder muscle relaxants. They do have side effects. You can get a dry mouth with these. Then there are some called 5-alpha reductase inhibitors, and these actually shrink the size of the prostate. But that takes time, so if you do start these, you need to persevere for 3 to 6 months before you see any improvement in symptoms, because it takes time to do that. But they can work quite well. And these tablets are finasteride and dutasteride. Then there are diuretics, and these actually help improve urine flow by increasing urine output. So these you would take in the morning so that you emptied out most of your urine in the afternoon, and then hopefully didn't have to get up so many times in the night. And then we have something called desmopressin, which actually reduces the amount of urine that the body produces, and you would take this at night time, again to stop you getting up in the night. So that can work quite well as well. So as you can see, there's a combination of different medications that we can use, and you might just be put on one of them, or it might be a combination of both. If your GP's trying these different medications and nothing's working, or if your symptoms are quite severe and they're not sure what else might be going on or what the underlying causes might be, they would refer you to a urologist for a specialist opinion. And a urologist at their fingertips has lots of different options as well as the medications. So surgery can be an option. And there are various different surgeries on offer. So there's a TURP, which is a transurethral resection of the prostate. Trying to trip me up again. And this is where the surgery is done from inside the urethra, and the prostate size is made smaller by surgery. The problem with some of these surgeries is they're very close to the nerves in the area, and some of the side effects of these can be erectile dysfunction. So it's often a last resort and worth thinking about before you embark on it, and making sure you've tried the medications. There is a relatively new surgery called UROLIFT, which is where small pieces of equipment are inserted into the prostate. It's a day case under a local or a general anaesthetic. You go home the same day, and they lift the prostate off of the urethra, and that can work very well. Not all hospitals are doing it at the moment because it's still relatively new, but I've put a link to it in the notes afterwards so that you can speak to your urologist about it if that's where you are. And it does seem that the follow-up that you need for this is much less than when you have a TURP, so that might be a benefit for you. There's an open prostatectomy, I'm trying, and this is where through a cut in your tummy they go in and cut away the prostate that's causing the problem. So that's bigger surgery obviously, and you'd need a general anaesthetic for that most of the time. Or there's a cystoplasty, where a small part of the wall of the intestine is taken to make the bladder bigger than it currently is, so that it can take more urine and not put pressure on you to want to pee all of the time. Botox can sometimes be used to relax the muscles of the bladder, if that's one of the underlying problems. And at the same time, sacral nerve stimulators, so small electrical stimulators, are placed inside the body to stimulate the sacral nerve and just improve the symptoms that way, if that's your underlying problem again. And as a very last resort, there's urinary diversion, where the ureters, which are the tubes which come from the kidney and deliver urine into the bladder, are cut away from the bladder and brought up to the surface of the tummy to actually empty out into a bag, so you don't pee through your penis anymore. So obviously all the symptoms go, but that's a fairly drastic surgery and you will always have a bag. So those are just the options, and obviously lots of them are last resort, and all of these have to be done under the guidance of a urologist or a specialist. Complications of BPH, there are two main ones, and the first one is acute urinary retention, where you get to the point where you can't actually empty your bladder at all, and that's a medical emergency when it happens. And the treatment for that is to artificially empty the bladder with a catheter, which is a small tube which is passed up inside the penis into the bladder. Now a catheter can actually be used left in all of the time, and it empties out constantly into a bag which is usually strapped to your leg, or there can be just a catheter which is put in to empty your bladder and then taken out immediately. And you can actually be trained to do that yourself, so that's self-catheterisation. The other complication of an enlarged prostate can be recurrent urinary tract infections, and this is because where the prostate is putting pressure on the urethra, it's slowing the urine down as it comes out of the bladder through the urethra and the penis. So some of that urine can sit for longer than it should in the bladder. This is called stasis, and that urine, because it's sitting there longer than it should be, can become infected. Now if this is a one-off, or just every now and again, it can be treated with antibiotics. But if it's happening repeatedly, you could have prophylactic antibiotics, so taking a lower dose antibiotic every day to try and actually stop the infections from developing. So that's the other main complication alongside acute urinary tract infection. Okay, so now on to the second part of our vlog for today, and this is prostatitis. And prostatitis is inflammation or swelling of the prostate, and it can be very painful, very uncomfortable. It's often bacterial, but it sometimes can not be bacterial at all, and we don't really know what's causing it. And it affects all ages, but it's more common in 30 to 50-year-olds. It's quite rare, it affects 5 to 10% of men in a lifetime. But when it does happen, it's obviously very uncomfortable. There are two types of prostatitis. There's acute, so that's sudden onset, very severe symptoms. It is definitely caused by a bacterial. It's like a man's urinary tract infection. Or there's chronic, and the symptoms come and go over time, and they last for a long time. It's the most common type, and it's not bacterial usually. The cause of chronic prostatitis is not that clear. So what are the symptoms? Pain in the lower abdomen, the genitals, the lower back and the buttocks, which can be quite disabling. Frequency of urine, so wanting to go all of the time. Difficulty actually peeing when you go. So very similar to cystitis for the women who are watching this. Pain when you ejaculate, and pain in the perineum, which is the bit from your anus, the bit of skin from your anus passing forward between a man's anus and his testes, and it's very uncomfortable. So what are the things that put you at risk of getting prostatitis? So passing a catheter, which we've just spoken about, into the penis. Having a biopsy, so if we're worried about your prostate and we do a biopsy, you can be at risk of this. Having a urine infection. Having a sexually transmitted infection. Having some sort of anatomical problem with your urinary tract, so it's not formed in quite the right way. Anal sex. A pelvic injury of some sort. And for chronic prostatitis, being middle-aged, having a previous bout of prostatitis, having irritable bowel syndrome, and having been sexually abused. So these are the risks for prostatitis, both acute and chronic. How do we diagnose it? Well, it's normally a clinical diagnosis in your GP surgery. Quite often we will again pop our finger in the backside to feel the prostate, and it will quite often be tender when we do that. We will dip your urine for infection to make sure that that isn't the cause, or you haven't got a UTI sitting alongside it, and we'll decide from the history whether it's acute or chronic. So what's the treatment for prostatitis? Well, if it's acute, you'll need 2 to 4 weeks of antibiotics, and if you're very sick from it, even a hospital admission. If it's chronic, and we can tell this from the course and the history, whether it's sudden onset or not will differentiate it from acute. Pain relief is the first thing that we would do because you could be in quite a lot of pain. An alpha blocker, which is one of the medications I spoke to you about before, which is a muscle relaxant. A much longer course of antibiotics, 4 to 6 weeks. And we may even give you a nerve pain reliever, so something like gabapentin. There is also something called asymptomatic prostatitis. So it's an inflamed prostate but with no symptoms, and we often only discover it because we've done a PSA for another reason, which is the blood test that comes from the prostate gland. And the PSA will be raised, and also if we do a full blood count, we'll see raised white cells and maybe even pus in the urine or white cells in the urine if we dip the urine. There's no treatment needed for chronic prostatitis, but if it gets discovered when you're having treatment for fertility, it may well be treated because long term it can cause problems with fertility. There is no evidence at all, and I think this is important, that prostatitis in any form is linked with an increased risk of cancer. So I'm often asked by patients, how can I prevent prostate problems? The answer to that is we don't really know, but there are some suggestions. So a diet low in saturated fat, high in fruit and fibre has been recommended for BPH. No herbal remedies have any evidence behind them in terms of proving useful, but lots of people do use them and say that they work. There is some evidence on selenium, which is a supplement, but again the evidence is mixed and it's coming up against at the moment. And experts recommend good hygiene, including the penis. There are lots of tips and things like acupuncture, weight loss, probiotics, phytotherapy, CBT, and even pelvic floor strengthening. And I'm going to put a link to a site afterwards which talks about all of these. There's very little evidence, as I've said, but as you know, I don't dismiss anything because if it helps you, that's absolutely fine and good. So finally, hopefully what I've shown you today is the prostate is a really important gland for men, just as the ovaries and the uterus are for women. It affects men as they age, and a lot of men, especially as they get older. It can present a really difficult and ongoing disability in terms of pain and discomfort and disruption with life. So the most important thing is come and talk to your GP because we do have some solutions and we're more than happy to try them and talk to you about it. And none of the things I've spoken to you about today are prostate cancer, so you don't have to worry about that, and your doctor will rule that out when they're diagnosing you. But I will do a vlog in the future on prostate cancer. So hopefully that's helped. I've put some great links afterwards, so have a look, and hopefully there'll be some questions that you've got. Please ask me, and if you have suggestions for future videos, please send me a message. Thanks ever so much for listening as always.